Hey guys, it's Dave. Today we're going to talk about some nutrient depletions and mineral depletions that we're seeing in our diets today. We all know that we need to exercise and eat healthier. We eat more fast processed foods than any other generation before us, and we're not getting out exercising, we're not working outside, so we're not getting some key things such as vitamin D that normally our predecessors would have in the past. Fresh fruits and vegetables are more expensive than a bag of chips. Plus, you don't have to clean the chips and peel the chips. It's just easier to grab a bag of chips. Because we're not getting the same nutrition that we should be getting and that our grandparents got and our great-grandparents got, our bodies are lacking a lot of the key nutrients and vitamins that help us prevent illness, ward off sickness, and just perform at the top level both physically and mentally that we can. On top of all this, certain medications and chemicals can cause depletions of vitamins and minerals in our system as well. Vitamin D is a great example. You hardly ever in the past had people low in vitamin D because everybody was outside, working, playing, doing whatever. Well, now in the winter months, you will very rarely see me outside unless I'm hunting. And then you have my hands and face might be the only thing exposed to the sun to get the natural vitamin D that we need. So in the northern latitude areas, especially in the winter, we need to supplement with vitamin D. I recommend taking at least 2,000 units a day. Taking it with vitamin K in the vitamin D supplement increases absorption, so you want to make sure you check your labels on that. Pure Encapsulations has a good one, as does Orthomolecular, and both of those are on our website. But vitamin D is important because it helps fight off infections. It boosts your immune system. It helps prevent depression, and it is a very strong free radical. So get your vitamin D in. Birth control can deplete vitamin B6. Why is that important? Because vitamin B6 plays a key role in the production of serotonin. A lack of serotonin can lead to depression. I actually ran a report when I came back from a conference and looked at all my female patients that were on birth control or hormone supplements like Premarin, estrogen, things like that. And a vast majority were also on an antidepressant. So it's very important if you're on birth control or hormone supplementation that you're also taking B6, 100 milligrams once a day. Folic acid. In a normal, healthy diet, you get plenty of folic acid and you don't need to supplement. However, in today's diet, quick, grab it and run, we are not getting the folic acid that we need. A lack of folic acid can cause sores in the mouth, fatigue, sores also on your tongue, and studies have shown that if you're not getting enough folic acid, you're going to be more prone to heart attack and stroke. So it's a good idea to supplement with 400 to 800 micrograms once a day. If you're on a proton pump inhibitor, so Prilosec, which is omeprazole, Acifex, which is rabeprazole, Prevacid, Nexium, tonics, all of those can deplete both your magnesium stores and your vitamin B12 stores. So I recommend vitamin B12 at 1,000 micrograms once a day and magnesium 250 to 500 milligrams. And if you take that in the evening, it will also help you sleep. Magnesium glycinate is the best absorbed, so it also is a little harder to get. We do have that on our website as well. Another thing that depletes your vitamin B12 is metformin. If you're on metformin, vitamin B12 1,000 micrograms once a day is a good idea. If you're on metformin and a proton pump inhibitor, I would increase that to 2,500 micrograms once a day to help replenish what's in your gut. So if you're on a proton pump inhibitor, a probiotic is a good idea as well to help get things regulated. Floragen makes a good one. Orthomolecular makes another good one, as well as pure encapsulations. You want to check your label on your probiotics. They should list both the genus, species, and class, all three. If they don't, look at another one. Capsulations also makes a good probiotic as well. Another thing that can wipe out your normal GI flora is antibiotics. If you're on antibiotics, again, you should be taking a probiotic to help restore your gut for at least 2 weeks. If you're on an antibiotic for 10 days, I would take your probiotic for at least 2 weeks. It doesn't hurt to take it for a month or even more to get your gut regulated. Drugs like erythromycin, tetracycline, doxycycline, those can wipe out your gut and take up to a year to get it back to normal. So if you can take a probiotic, it will help out. Clarithromycin is another one that will really wipe out your gut. So make sure you get on a probiotic to get that gut regulated, because your gut is linked to things like inflammation and can be linked to things like mental health disorders, depression, psychosis. So get your gut regulated to help the rest of your body out. Fiber supplements are something else that will help your gut, as well as if you're a female, we're talking about preventing issues with depression and things like that. A good fiber supplement will help that out as well. We have them on our website. Pure Encapsulations, again, makes a good fiber one. Orthomolecular makes a good fiber one. But just get that diet boosted with some good fiber every day to help you out. If you have any questions or concerns, it's always best to discuss it with your provider or pharmacist before starting any supplement.